I'm 5'3" and about to be 19 years old, and you should listen to me because everything I know is because I wanted to apply it on me, but I never wanted to sell it to you for views, and I do not recommend any kind of drugs uses. Please, before using any kind of drugs, go to your appropriate doctor and get checked, and let him as a specialist prescribe you medicines. Growth hormone goes to liver and interacts with insulin in the liver and produces something called IGF-1, insulin like growth factor 1, and IGF-1 goes to your bones, the growth plate part, and then tells them to lengthen your bone. We need two things. Growth plates fuse, so we need to increase the period for which the growth plates stay open, and second, we need high levels of IGF-1. So let me start with the first drug, that is anastrozole. What this basically is going to do is decrease the amount of estrogen in your body. Estrogen is the main driver for your growth plate fusion, so to prevent it we are going to use it. Second, cabergoline. This is actually used in acromegaly patients who have a tumor in their pituitary to decrease the amount of elevated levels of growth hormone and IGF-1 in them. That's actually a completely different mechanism through which it actually decreases the amount of growth hormone and IGF-1. But in normal individual which have normal level of growth hormone and IGF-1 or slightly less level of growth hormone and IGF-1, what it does is it removes the prolactin's brake on growth hormone and it increases your overall growth hormone and IGF-1. But wherever you are going to research about cabergoline, it's only going to show you the acromegaly stuff. You have to find out about the cabergoline stuff yourself. Of course, I'm going to make a video on it. Third, tamoxifen. Estrogen, the thing that closes your growth plate sooner, is the same thing that contributes to some level of IGF-1 in your body. So tamoxifen is going to help you with that. Now tamoxifen is also the thing that prevents your estrogen from getting too low. It contributes to some IGF-1. It prevents your bone from getting osteoporosis. Estrogen is very important for your bone density. We use anastrozole plus tamoxifen in combination to maintain your estrogen in the Goldilocks zone. Okay, now there is a substitute to anastrozole, and that is more effective than anastrozole. That is letrozole. Letrozole is a second or third generation of anastrozole. It is a much more potent form. If you take letrozole, it is going to crash your E2 very fast. So to prevent that, we are using anastrozole. And if you use letrozole with tamoxifen, then the effectiveness of letrozole is going to decrease. They just react with each other. Okay. Now third or fourth, I don't remember. Okay, forget the numbering. Okay, I did anastrozole, I did cabergoline, I did tamoxifen. Now clomiphene. Okay, clomiphene citrate. What is clomiphene? Clomiphene basically increases your testosterone. As your testosterone is increasing, your IGF-1 growth hormone respond to that, and they also increase. Clonidine, the last one is clonidine. Now what clonidine is? Clonidine is a blood pressure medicine, but at low doses when given to growth hormone deficient children or to people who are having normal levels of growth hormone. What we have seen is it actually gives you a growth hormone spike. So we actually need to take this in night just before we sleep because it has some dizziness effects. Forget that. Okay, the main reason is our pituitary needs a 24-hour relaxation before it can just squeeze all of its energy in producing growth hormone. So like in the night it produces most 90% of its growth hormone, more than 90%. In the day throughout it produces small amounts, very small amounts. Okay, but when you take clonidine in the morning, it is actually going to give you a spike, but the spike is going to be small as your pituitary is tired. But when you give it when it's fully rested, while before you sleep, when it's naturally going to peak and you are forcing it also to peak, then there is something you must have read in physics, the constructive interference. Those let's not get into those things. When they interfere with each other, both the peaks combine and form a larger peak. So like it basically compounds and it basically gives you a much more greater growth hormone peak. Okay, so like that's it. These are all the drugs. There are other, of course, there are substitute to clonidine, the less effective one, but peptides are going to be your best method on how to grow taller. But if you don't have the budget for peptides, before running any kind of drugs. If you are at the last stage of your puberty, then do this first. X-ray, these are my x-rays. I'm going to attach the pictures. Take it as a written form from the bone doctor that your growth plates are open. Then go to the endocrinologist and ask about these medicines so that you can grow much more taller than your genetic potential. Okay, a lot of things I've covered in this video, a lot of unwanted things also. I'm going to make a separate video on mechanism and a separate video that I cannot talk about, and that's the most interesting video. Okay, that's the most interesting. You think this is interesting, that is going to be even more interesting. I actually haven't seen anyone on internet use any of these meds except anastrozole and letrozole, those kind of things. People on the internet actually use anastrozole, no, not anastrozole, letrozole and those peptides. Okay, good method, but the thing is, when you use letrozole, your E2 is crashing too low, you are getting bone pain. The contribution of E2 in increasing your IGF-1 is eliminated as your whole IGF-1 is increased by peptides, but the thing is, your bone density that might be permanent. So to prevent that, you might want to take, even if you are using peptides, you have a lot amount of cash, don't use letrozole plus tamoxifen, use anastrozole plus tamoxifen. Use anastrozole plus tamoxifen plus peptide if you can. I promised you the next two parts, so bye bye.